Here's that angle. How you doing, guys? This is Dr. So at Specific Chiropractic. In this video, we're going to talk about severe neck pain. So this gentleman over here, you can show to the viewers. Let's see what you can do. Yeah, try not to turn your torso itself. Just try to turn. How much can you turn your head to the left? How much?
That's it.
And turn your head to the right. Okay. How about tilting your head? How much can you tilt? Not a lot either, right? Tilt your head to the. Okay. What about looking down and up? Okay. Yeah, as you can see, yeah, so we all can see that you got a lot of limitations, not much range of motion. What happened? What caused that fella?
I did stretch and did self-click. I put pressure over here and then just got locked up, very painful. And then one day after, came over here.
Gotcha. So there you go, guys. That's a big reason why we don't want to try to self-adjust yourself or self-track yourself, because, and we'll explain that more in depth later on, it's just that there's a liquid ball bearing on the inside and there's no way to accurately put that yourself in the correct position. So therefore it got knocked out of alignment, and that's why we're in this trouble right now. And we're going to take a closer look, see what's going on, all right? When we take a look at the x-rays over here, one bone really stands out, and we have this degenerated joint disease right here at that fourth cervical over here. Okay, now this is not the typical type of location. Majority of the patients, when they have a degeneration in the neck, it's usually 5 and 6, but not number 4. Okay, so during the consultation, you told me one heck of a crazy story. How, care to share to the viewers? How'd you?
I ran, we played soccer and there was a cable hanging and it got cut while I was running full speed, got cut in my neck. It was 15 years ago, I was 15 years old, and I fell on the floor and hit my head and had a brain concussion. And yeah, that's it, 1 week in hospital.
Yeah, that's crazy. Because I'm glad you didn't get decapitated or nothing like that, because that's one heck of an injury. Because it's not typical to have that kind of degeneration at this level over here. Okay, pretty much like 95% of the patients we see here, when they have degenerated joint disease, it's either at 5 or 6, but not at 4. So that fellow over there, that's sticking like a sore thumb. We're going to confirm that on you during examination. But at the same token, I also want to find out, okay, what's also causing this thing to degenerate the way it is, this pattern, because, if it does fit with the time pattern you experience, because this is roughly about 15 years worth of damage here, 15, 20 years. So now backtracking over here, and I'm looking at things from a 3-dimensional perspective in terms of what caused things to twist like that, okay? So we're gonna look all straight down. So by tracing all straight down, I do see we have one twist over here, so there's something around at this level here, with another twist over here and another twist over here. But when we go trace it all straight down, then we found something at this right hip over here is sinking down on the right hand side. In addition to, this line is also going forward this way, and it's taller over here on that obturator foramen. So 3-dimensionally, what I'm seeing right now is your right hip is sunk down this way, you're rotated this way, and tilted back this way. So how are we going to move our head this way? That's going to be tough. The 2 gyroscopes in our brain force our head to try to level this way. So your body's going to try to twist, to compensate, to try to keep this head centered and leveled as much as possible. So that helps explain why we're seeing this interesting weird twist we got over here. Twist this way, twist that way, this way, and that way over here. So therefore, I do want to take a closer look what's going on with this right hip, but also in addition to looking at these sacral segments, this is very swollen over here. I see a huge gap over here. It's narrowed down here and very wide on top here. So this second sacral segment is a potential fellow. So then we're going to confirm that again on your examination, and we're going to find out which one we need to adjust first. Do we need to address this one over here or the right hip? And on top of that, okay, I do see some degeneration on the back over here because it's also wedged this way. That helps explain why, and also in addition to, this fellow over here, it's been there for quite a while. It's not a recent injury, it's old. That's what caused this fellow over here to degenerate, because our lumbar spine is supposed to move like this, slow and steady. But if your foundation over here, if it moves too much, what's going to happen? It's going to start grinding it away. And that's what happened over here. This disc got swollen, okay, to compensate, because if this thing is moving if the foundation is moving too much, it's trying to lock up number 5, but if it locks up number 5, that means the rest of the spine can't move either. Something else got to move more to compensate. This is starting to move a little too much. That's why this disc is starting to get swollen and get aggravated. Okay. Now, you're tracing all over here, and that's how I can tell this right hip has been there for quite some time, because I'm seeing degeneration and rust on this side. So there is a crisscross pattern. Why? Because if you're twisted over here, guess what? The rest of your torso has to keep on moving this direction to compensate. So therefore, your left side is going to wear out more than it should. That explains that degeneration over here. And now we're talking about what's going on over here. Okay. So that fellow over there, we see on here, also to the viewers, we're supposed to have this liquid ball bearing. Okay, so that's what allows us to move all 360 degrees. But when there's some kind of trauma and the disc is damaged, this liquid ball bearing, as you see from here, centered, is start moving backwards. All right, and if it continues that damage, all right, eventually it's just no different like this fellow over here is just kind of trying to roll off the table. The body says, "Hey, whoa, fellow, where you going? We're going to keep it in place." Right? So as a result, this liquid ball bearing, it starts shifting out of alignment. Your body is trying to keep it in place. That's what we see, these degenerated osteophytes coming along. They try to build up these barrier containment walls to try to keep it in place. Now this is what we were talking about before. If you try to self-crack yourself, how do we know we could get this liquid ball bearing in the middle? Okay. Now most of the time when you, and a lot of people says, "Hey, what's going on?" You says, "I cracked my knuckles." Nope. But the reason why that's not a problem, because there is no liquid ball bearing inside of it. Okay, it's just like a hinge joint on a door. I'm not too concerned about that. But the spinal discs is a whole different ball game. Because of this liquid ball bearing, all right, most of the time when we try to like on our neck, we're actually popping these joints over here instead. That's what's making that higher pitch noise. The lower pitch noise is here. And this is very difficult to try to realign yourself. So when you try to pop yourself, while yes, you do feel some relief, and you got relief over here, okay? And the reason why is because biomechanically, it's a 3-point, it's a tripod over here, okay? We put half our weight over here, and we also put some of weight also on these joint spaces over here as well. So it's this tripod configuration, okay? So when you do self-pop your neck, yeah, you feel a little relief here, but actually what's going on here is you're pushing this liquid ball bearing even more outside. And when it becomes even more unstable, the gyroscope in our brain recognizes, hey, whoa, this thing's incredibly unstable. Okay, guys, the muscles in our neck start locking up to try to stabilize, because right now this is moving way too much, so therefore it's swelling up, which acts like an airbag trying to stabilize, and muscle splints up and tighten up to try to stabilize even more, to allow these 25 breaches of the dams to try to heal up. All right. So therefore, we're going to confirm that on you, which one we need to address, and we're going to realign it as best as deep as possible to allow your body to try to shift that ball bearing back in the middle as much as possible. All right. That's what the story is. Let's get to work. Okay, guys. So now we're starting our visualization. And this is confirmed what we already saw and mentioned before. You see this area over here, guys? That's a lot more swollen compared to his right side. Now, left side's just not happy. And when we palpate, okay, all his muscles are much more tighter on the left. See, it's nice loosey-goosey on the right-hand side. See, his traps over here is all tight. See, a little more softer on the right hand side. Now tracing downwards, yeah, we've got some more swelling over here. Okay, so I'm gonna mark that level. Okay, and same thing over here, that's gonna be right in the middle. See, we got some puffiness, some pinning edema at this level here too. See, there's something in here, the 4. Tracing down. Yeah, see, right at this 2S level, we got something there. See, even at the right SI joint, see, there's some swelling. Over here, yep. Tender right here a bit?
A little bit.
A little bit, right? What about here?
Yes, so you put the finger up.
Yeah, we're gonna scan your spine. We're gonna look for potential levels for an inflammatory process. We found one potential level there. Another one over here. It's nice and quiet. Okay, we have a small little reading here that indicates it's chronic. It's been for quite a while. Same story with this right SI joint. See anything on the 4? Very little on the 4. See, we got another one at the second dorsal. Let's scan in the neck. See, we got another one right there. You know, left hip got some fixation in there. Right hip also got some fixation in there as well. See, now we're testing this second sacral segment. It's not moving too well. How's that feel right there?
A little bit pain.
Yeah.
Painful, yeah, painful.
It's not fun, right? Yeah. The 4 is somewhat asphyxiated. So it's going right up here. Okay, oh no, we got an inferiority here a little bit. This may or may not go away after adjustment, 50-50. I'm gonna mark this level. We'll keep an eye on that. But this, 6, that gotta go. That's not gonna adapt well after we adjust. And of course, second dorsal, decent.
It was painful right now.
Yeah. Because this
is this one, yeah.
Mm-hmm.
Yeah.
Because that second dorsal, yeah, that second dorsal providing foundational support for your neck. So
It's her to the left side.
yeah, understood. Okay. Oh, this is all boggy and filled up here. Something up. Yeah, I know it's not fun. How's that one? Not too bad. Surprisingly enough, the 4 is moving. The 5 is not. See, that's your 5. That's a brick wall. That's not moving whatsoever. Okay. All right. So that's gonna be our fella. Good. Come on up.
Feels good right now in the back. The back feels good. The neck is still stiff.
Okay. We'll get the rest of it. Okay. Where's that sweet spot? Right at this. Here's that angle. Okay. Go ahead, touch your neck. See how that can go.
To the right there is no pain at all.
Mm-hmm.
To the left there is pain, but I can look fully.
Nice.
Full. Like, it hurts, but I can look. I can look and
Okay, don't go too crazy on it because
Yeah.
the disc herniation, what it did was it went that direction this way, okay, to the left-hand side. So therefore, that's why we nudged it, pushed it forward, and sent it over here, okay? All right, so here's gonna be your homework, all right? I need you to ice your neck over here. You're gonna do it for 20 minutes, okay, every 2 hours. Let it calm down, and the next visit, we'll take a look, see how it's responding.
Alright.
Okay?
Alright.
You're all set.
Thank you.
Oh, you're welcome.